The use of the prescription opioids has just skyrocketed since the mid-1990s, and right along with that, there's been an increase in treatment admissions associated with these medicines and a death rate associated with overdose related to prescription painkillers. It's been a fourfold increase in treatment admissions, and right now, prescription opioid deaths are described as an epidemic by the Center for Disease Control. We had to respond to this. It was our responsibility to make sure that we're helping our patients with opioid dependence to the best degree possible.
In my opinion, medication-assisted treatment for addiction is no different than medication-assisted treatment for any other disease. We're going to offer them 3 different tracks for dealing with opiate addiction. One track is going to be to use buprenorphine. The second track is to offer injectable naltrexone. And the third track is, of course, to be abstinent and to use therapy. Naltrexone is a medication that blocks your opiate receptor. Imagine your receptors in your brain as like a button. And if you take different drugs, it pushes on different buttons. And naltrexone is a drug that blocks the opiate receptors. So it kind of prevents your ability to get high when you take pain medications or heroin. And it also tends to help cravings. It is not abusable. It has no street market value that's great. And so it's a relatively safe alternative for people to use if they choose to get well but are struggling too much with the physical symptoms of addiction. Buprenorphine kind of hits on the opiate button and also blocks the opiate button at the same time. So it's a much more nuanced and complicated chemical in terms of its actions. It can be abused on the streets. It can be diverted, and we know that it happens. However, in controlled settings, it can help people come off of pain medications. It can prevent overdose. It can prevent people from getting hepatitis C. And that's the ultimate goal.
It's going to work in tandem with the 12-step abstinence-based program. Well, our hope is to use medication-assisted treatment to stabilize someone and give them an opportunity to engage in an active 12-step program of recovery. The medication itself is an opiate, but the way it's being used with close monitoring, with purposeful clinical interventions over a longer period of time to provide stability is not in an addictive manner.
We're going to be closely monitoring people. We're going to use urine drug screening on a regular basis. We're going to monitor their behavior. We're going to require that they're still involved in our outpatient treatment programs. Initially, they'll be very involved a few times a week. Over time, as they get more responsible, they get better off in their recovery. They won't have to come as frequently, but we really want to keep track of them and be sure that they're on track, that they're staying sober, that they're getting into good recovery and doing those things that reveal good recovery. And ultimately, we'll have people come off these medications.
Hazelden has often pioneered new ways of better providing treatment. And I think of the Hazelden model of treatment, multidisciplinary team, continuum of care, dignity and respect, and 12-step abstinence-based. And I see this process as really very consistent with that innovation, that pioneering element, and triggered by the same thing. We are looking at a population that is presenting far more of a challenging profile than many patients on other drugs of no choice. And similarly, responding to that is very much a part of who Hazelden has long been.
We're responsible to take care of the people that come to us with opioid dependence. We're responsible to use the science to do so. We're responsible to the whole treatment field to try and lead the way and describe how an abstinence-based, 12-step oriented program can use these medicines appropriately for the treatment of addiction.